Hello, my name is Pranav, and I'm a part of the Health Needs RX Spotlight team. We're an organization with a mission to empower people to make their own healthcare decisions. We create video content and information guides on essential topics like chronic diseases, mental health, respiratory illnesses, health literacy, and more to help people optimize their health. Today, I'm joined by Dr. Leon Barkodar, a neurologist who's a headache and migraine specialist in Los Angeles. We'll be discussing more about headaches and migraines. Thank you so much for joining us today.
It's absolutely my pleasure. Thank you for having me.
So, what made you specialize in the field of neurology?
Yeah, so I knew I wanted to go into medicine from a very young age. I wasn't sure about the specialty. I always thought I would get in there and see what piqued my interest. And neurology just really piqued my interest. I think there is just so much undiscovered about the brain and the nerves. And I wanted to be part of a field that is really rapidly expanding. Not that the other fields aren't, it just to me, it seemed like this was just going at light speed compared to the other specialties.
Absolutely, that's so interesting. Can you talk about, so going into sort of the questions about headaches and migraines, can you talk a little bit more about like the difference between headaches and migraines?
Yeah, headaches is just a general term for any sort of pain you might have in your head. Migraine is just one type of headache. There's numerous types of headaches. If you get hit in the head with a ball, that'll be a traumatic headache. If you had a bleed in your head, that can be a intracranial hemorrhage causing a headache. If you have a lot of tension in your life, you might have tension headaches. So migraines is just one category of headaches, which is just like an over-encompassing category.
Awesome, that makes more sense because I feel like a lot of times like people tend to confuse those terms and like use them out of context. So personally, I actually deal with migraines with aura. So what's sort of the best thing to do when you're experiencing that aura episode?
So assuming you know that it's a migraine and maybe you've already seen a doctor, you've done some really good research, and you're like, hey, this really is a migraine, and you get an aura. The auras usually precede the headache component of a migraine. In fact, some people don't even need the headache component. Sometimes it's just the aura. But when you do get the aura, the most neurologists feel that treating that as soon as possible is the best way to prevent this from becoming into something really debilitating. Migraines can last hours, sometimes days for people. And if you can prevent going into that long, painful cycle, that's your best option. So I would treat it immediately. And how you treat it, there's a lot of different options. I too have migraines. Mine are very infrequent, and I'm very lucky because I can just take an over-the-counter pain medicine and it goes away after a couple hours. Some people aren't so lucky. So probably what you need to do is, if you are lucky and they're really infrequent, you can take an over-the-counter medicine. If you really don't like medicine, you can always try going into a dark room, closing your eyes, putting a cool towel on your head, and hoping that it goes away. Now you have to be one of the lucky ones for that to work. If those types of things don't work, then you really just should see a specialist who can give you some maybe something stronger or some better recommendations.
Yeah, personally, I waited a while before I saw a specialist for my like migraines that I was experiencing. Like I thought I was kind of like making it up when I first was experiencing. I'm like, I don't know, maybe it's just like I'm seeing something weird. I don't know. But I started noticing that pattern happening over and over again. So I try to like abort the episode right when it happens. And
Yeah, that's the key. If you can get to it before it becomes really severe, you'll be in better shape than trying to wait until the headache's severe. I feel like a lot of the mentality of the patients that I have, especially the first time that I see them, is I hate medicine. I really don't want to take it. It's the last thing that I want to do. And I completely feel the same way about most medications. If I can kind of get by through it, why do I want to give medication to my body? So as I was saying, a lot of my patients and myself too, like I try to avoid medicine if I really don't need it, if it's not going to be, like a life concerning thing, or it's not really going to make a big difference to my health. Sometimes I'd rather suffer until I really need it. Migraine is kind of the exception to that, because if you don't get at it right away, you could be stuck for hours or days. And at that time, it might be really hard to treat.
yeah, absolutely. Currently I'm like on some medication and like the side effects are a little bit um I mean, they're not terrible, but again, I would like prefer over the counter stuff. So, and going to my next question, what are some things that cause headaches and migraines?
Right. So it depends but what you mean by cause. So some people are just unlucky and they are genetically predisposed to have migraines. And we see a lot of strong family histories in people with migraines, although it doesn't have to have a family history. So some of it is luck. Then you have the other aspect of it, which are the migraine triggers. I think you were going to ask me about that later. So if you happen to be one of these people who can get migraines, there is a lot of things that can be triggers. I would say almost anything, but there are a few things that are more common triggers. So the more common ones are going to be things like stress, probably the most common, hormonal changes, alcohol. We used to think wine, but probably any alcohol can be a trigger. Some people think chocolate. Caffeine is an interesting one because some people, caffeine can help their headache. Some people, caffeine can trigger their headaches. Sometimes you get from a caffeine withdrawal headache, or that can even trigger your headaches. So many different things can trigger them, and it's probably very individual to the particular patient.
Yeah, absolutely. And since you already went into the triggers, I'll go into like the next question as well. So what's sort of the situation where someone should report to emergency room for headache symptoms?
Right. So that's probably a good question for headaches in general. Probably most patients don't know, unless they've done great research, may not know what their headache is. A migraine in and of itself shouldn't be dangerous, but sometimes we're having a headache and we don't know, is it a migraine or is it something else? So there is a few things that we can pay attention to see whether we need to seek immediate care in the form of an emergency room. So the way that I remember this is if this is your first or worst headache. So if you've never had this type of headache before and it's brand new for you, that's a concerning thing. That's different than the person who's had headaches for a few years or they've had migraines for a few years and they've had this a bunch of times. Maybe it's terrible and uncomfortable, but you've already had this. You've seen the doctors. No need to keep going to the emergency room unless there's something really new about it. The next thing is worst. If this is the worst headache that you've ever had, or the pain is really unbearable, or if this is really sudden onset, then you definitely want to go to the emergency room to rule out a more dangerous condition. Also, if you start having other neurological symptoms with them that you're unfamiliar with, if you're confused, overly tired, just not acting like yourself, if you're having vision changes, um, if you're a lot older and then this is a new onset thing for you, if let's say you have a history of migraines, but this is just not your regular migraine, it's a totally different headache. So those types of things, should kind of say, hey, this might be something more serious. I should go see somebody, very soon, and perhaps even go to the emergency room. Another reason is if it's a post-traumatic headache. So let's say you got hit in the head, and now your headaches are there and they're getting worse. You probably want to go to the emergency room as well to rule out a more dangerous condition.
Yeah, absolutely. Thank you for sharing that. And then are headaches or migraines like damaging to the brain at all?
Usually not. Usually not. So I would say in most cases, headaches and migraines aren't damaging. And if I assume you mean in the sense of permanent damage to your brain, and in that sense, the consensus is in the vast majority of cases it is not.
Okay, that's good to know. Also, what are some medications for like headaches and migraines?
Yeah. So there is a lot. I think you have a few other questions that you're going to get to about treatments, and so treatment in general can be anything from lifestyle changes. So, some people get headaches because of their diet, because they're skipping meals, because of their sleep schedules, and in those cases, sometimes all you got to do is fix that aspect of your life to the best that you can. Then there's other things to reduce stress, meditation, yoga. There's acupuncture. So those are some maybe some non-medication type things that we can do to reduce headaches. If those things don't work, there's always supplements. Some of the more popular supplements are magnesium or vitamin B2. Those can work great for some people. Other people, they try all the lifestyle changes and all the yoga and stress relieving factors and all the supplements, and it's still just not good enough. And at that point, we have to consider medication. Medication, there's a lot of headache medications out there, and we break them up into two groups. We break them up into the medication that you take when you're having a headache to get rid of it, and we call those abortives because they abort the pain. And then we have medications that prevent the headaches to begin with. So something that you take all the time, and that's to prevent them from even coming along. And we have a ton of medications in both of those situations, abortives and preventatives. And then moving on even further, we have injections. We have both abortive and preventative injections. And we have things like Botox that we might give every 3 months. It's essentially the same as cosmetic Botox, only we give it into different places with a different protocol. And that can also help prevent headaches. So I know it's a long-winded answer, but I guess the answer is there's so many things that we can do, so many treatments, whether it's non-medication based or medication based or injection based that we can do, and there's usually a good solution for everybody out there.
That's good to hear. And are there any side effects with some of these medications?
Sure, absolutely. You mentioned yourself, you take some medicine and you potentially may be having some side effects. All medication has the potential for side effect because there's so much variety in the types of headache medications. It's hard for me to just list them off. They can be anything from, feeling lightheaded or not feeling like yourself, feeling dizzy. Some people feel like they're just not as sharp mentally or cognitively. Some people can develop kidney stones from some of the treatments. So there's always the potential for side effects. I would say it's unusual to have a dangerous side effect. But when you kind of have that conversation with your doctor and they look at your medical history, a headache specialist should tailor something that will work with minimal side effects. And if they're wrong and you get the side effect, they should be able to change your treatment to something else.
Absolutely. And are there any like home remedies for headaches and migraines?
Yeah, so I kind of touched on this before. Um, a lot of people just need to go into a dark room and close their eyes and lie down and wait it out. Some people like to use a cold towel. Some people will take the supplements like magnesium or B2. I'm not sure if you consider that a home remedy, but certainly a more natural remedy. And if you happen to be somebody whose migraines really respond to that, then that's amazing. That's great. Other things that you can do, don't skip meals. A lot of people think that if you have protein in your meals, that can also help prevent them, stay really well hydrated. Um, and and if you do those things and you're lucky, then your migraines just might respond to them.
Absolutely. Yeah. I mean, personally, like I've heard from a lot of people, I mean, not necessarily doctors, that like, drinking water and then sleeping well are really big factors. So, I mean, I don't know if that's true, but I've just heard that sometimes things like that might also help.
Yeah, migraines are all about, if you're somebody who's going to get them, it's all about your triggers and your individual triggers. So some people, their triggers are alcohol, and some people, their triggers are lack of sleep, and some people, their triggers are skipping meals. And some people don't even need triggers, just life itself. Going through a day in your life might be a trigger if if your migraines are really sensitive. Um, so, so you got to figure it out for yourself in terms of identifying your triggers. And I think you're going to ask that later, but if sometimes your trigger is really obvious. I went out drinking and that always triggers a migraine. So that's simple. Other people's are like, I really don't know what triggers my migraines. And then you got to keep a headache diary and you just keep a log. Hey, I got a headache on this day. Did I drink my water? How much sleep did I get? Did I eat a certain food? And notice the pattern that on all of these, I get headaches every Wednesday, and Wednesday is meatloaf day. And that for me, that happens to be my trigger. So it will take for some people, it'll take work to figure out their triggers. But if you can figure it out, that's really the best way to prevent these things um, from becoming more bothersome in your life.
Absolutely. That's what I also kept track of too when I presented it to like my doctors. Like I had like a little journal that I was keeping track of like what I was sort of things that I might have eaten or how much I slept and things like that in my journal. So just for advice on like keeping track of things like that, like how many general things should people keep track of? 'Cause I know there can be like a lot of triggers. So
Yeah, so I'll be honest. I recommend a headache journal or diary to most of my headache or migraine patients, and most don't do a great job at it. Either they forget or life gets in the way, or who's keeping alive a journal with them. But the ones who do, I would try to keep it manageable. You don't have to if you don't have a headache one day, you don't need to write down no headaches. Focus on the days that you have headaches, and then pay attention to um, what you'd eaten. Okay, any unusual activities you had done. We'll know if it's a work day or a school day or a weekend. Sometimes we figure out they only occur on work days or only occur on days that I may be doing PE if I'm in school. So again, diet, sleep, any unusual activities, um, and for people who have menstrual cycles are also beneficial to keep track of.
absolutely. Thank you so much for sharing that. Also, is there anything else that you would like to share with us?
Yeah, headaches, like you said, are a huge category, and I'm glad that we started focusing a little bit more on migraines because it's such a huge world. Probably you have to figure out what your headache is first. If it's really a classic migraine and it's really infrequent and you can get by with an over the counter or some lifestyle changes, amazing. If you can't, or if it's one of these warning signs that we had discussed about before, then certainly try to seek some help. And one or two visits with a headache specialist can really set you up for a lot of headache-free days in the future, and save you a lot of frustration and kind of like time out of commission.
Yeah, absolutely. Thank you so much for sharing everything. It was wonderful to have you on this podcast to talk more about headaches and migraines.
Absolutely, it was my pleasure, and I wish you guys all the best.